If you know that you're traveling this season, you want to make sure that you watch this video. The reality is that a lot of emergencies that happens mid-flight are preventable. So I'm going to be discussing tips for you to travel safely. Make sure you share and repost this video to save lives and spread awareness. Protect yourself from DVT and PE. What is DVT? What is PE? DVT is called deep vein thrombosis. The reality is that when you stay still, when you sit in a place for long periods of time, blood clots can form because the blood is not moving. So that's what we call blood stasis. Now, when the blood clot forms, that is through the veins to the right side of the heart and it occludes the blood vessel in your lungs. When this happens, you can have sudden shortness of breath, coughing out blood, chest pain. It can be a serious situation that you want to prevent. So what can you do about it? Firstly, you need to know if you're at risk. Anyone can have DVT. DVT is usually found in the deep veins of the legs, usually. So what increases your risk for DVT? Contraceptives, hormonal treatment, pregnancy, recent history of surgery, or any situation whereby your blood can easily clot. So what can you do about it? Make sure you stretch every 1 to 2 hours. You want to make sure that you're moving. You don't just want to sit still. Don't be shy. Move around, walk around. Make sure that circulation keeps on flowing, especially during those long flights. You want to make sure that you're moving. You want to make sure that you're drinking enough water. When you're dehydrated, your blood can easily clot. Apart from walking around, you want to make sure that you wear compression stockings. That is if you're high risk, especially. What compression stockings do is that they gently squeeze your legs to keep blood flowing. Also, if you notice that or there is sudden shortness of breath, your leg is swollen, there's pain and tenderness in your calf, you want to make sure that you alert the emergency. Make sure you travel with all your medications, especially if you have chronic illnesses like hypertension and diabetes. You want to pack your insulin, your asthma medications, your blood pressure medications. Also, you want to consult your doctor if you are safe to fly. All right, and you also want to consult your doctor about the times because of the time difference. You have to change the time where you take your medications. Make sure you wear comfortable and non-restrictive clothing. You may ask, why do I need to wear comfortable and non-restrictive clothing? The reason is because you want to ensure that there's circulation flowing through your body. You don't want to stiffen up and you don't want your organs and your blood vessels to stiffen up. So you want to make sure that you're comfortable as much as possible. If you're feeling unwell or if you're too sick to fly, reconsider. Why should I reconsider? I really want to go on this trip. I know you want to go on this trip, but it is not worth it. Mid-flight, it is not comfortable. The oxygen levels are low because of the high altitude. So your body is already trying to compensate because it is not on the ground surface. Your body is already trying to compensate. You don't want a situation whereby you easily get sick or you are just worn out. All right, so you have to consider, consult your doctor if you're safe to fly. If you're unsure, make sure you share and repost this video to spread awareness.